I think it's important that patients understand that there is not one solution that fits all patients, and that every patient needs to be looked at from the perspective of what their hair loss, how much hair loss they've experienced. In some cases, a patient with a little bit of hair loss may find that medical therapy is the most appropriate therapy for them, and that they'll never go on to require surgical therapy. In other cases, there are patients who don't want to take medication for their hair loss. They want a solution that's going to be permanent and that isn't going to require that they continue to be on medical therapy. There are really very few situations, however, that I don't think medical therapy is a good adjunct to surgical therapy. But I also believe that each patient needs to be individually assessed. A patient can make themselves informed, and they can learn about the various techniques that are out there and what the distinctions are between the techniques. And sometimes some techniques are satisfactory in the long run, but I think that it's important for a patient to understand what the particular nuances are for different techniques. And it's not enough really for a patient to just see a couple of photographs of a doctor's patients. Typically, patients at my office will have an opportunity to actually see a patient close up and to actually examine their results close up, because what you want to know is not only will that cosmetic result look good in a photograph, but will it look good when you get out of the swimming pool? Will it look good when you're out in the wind and the rain? Will it look natural under all lighting circumstances? Will the scalp look like normal scalp? Will there be, minimal distinctions between their previous hair and the transplanted hair? And so I think it's important that patients understand that there's a number of critical factors other than photographs. I think a photograph is probably the first step in patients understanding what the results can look like, but there are a number of other things that they're going to have to look at when they want to try and ascertain the best surgical solution for them, or the best medical solution for them.